please join me in welcoming Dr. Amen.
Thank you so much. Well, what a joy for me to be here with you. I am thrilled. When I thought of Google, I'm like, so what's Google known for? Innovation and big data. Lots of data. Lots of my data, personally. What is Amen Clinics known for? Innovation. I'll share that with you. And we have big data. We actually have the world's largest database of brain scans related to behavior for psychiatric medicine. As of this week, it's 125,000 scans on people from 111 countries. Actually look at the brain. You know, psychiatrists are the only medical doctors who virtually never look at the organ they treat. Think about that. It's a little nuts. So I'm going to argue we should be changing that along with how we think about our brains. Just imaging study ever published on 21,000 people showing we could distinguish emotional trauma, post-traumatic stress disorder, from physical trauma, traumatic brain injury, with high levels of accuracy. And then in brain imaging and behavior, we repeated the study on veterans and showed the same thing a couple of weeks ago. It's the world's largest imaging study on pot smokers. And we compared people who smoke pot versus people who didn't, and virtually every area of their brain was lower. Especially an interesting area of the brain called the right hippocampus, which, think of the hippocampus, it's in your temporal lobes, as the gateway to getting short-term memories into long-term memory. And that area was the one area of the brain that separated those groups the best, and it was lower. Since we started imaging, whenever I would see scans of people who were smoking a fair amount of marijuana, they looked toxic. And I don't like that. To fall in love with your brain and then ask yourself this one simple question. So this is the short course to brain health. Every day you ask yourself this one question. Is my behavior good for my brain or bad for it? As our professors used to say, how do you know unless you look? And that actually became one of the themes of my life. 1979, I got out of the Army on the GI Bill, went to college and then medical school. So now I'm a second-year medical student. And I fell in love with psychiatry because I realized it has the potential to change generations of people. And with what we've learned about this whole new field of medicine called epigenetics, is that your habits are not just about you. Ultimately, they are about generations of you. So I became a psychiatrist. I trained at the Walter Reed Army Medical Center in Washington, D.C. But because of my imaging background, I'm agitating my professors, well, why aren't we looking at the brain? And they said, oh, well, it's not helpful. We don't have the tools yet. And when I was in medical school, that's when MRI came out. And I'm like, well, shouldn't we be doing something? And so I literally spent over a decade frustrated, agitating for us to look at the brain. And then in 1991, I went to a lecture on brain SPECT imaging. SPECT is a nuclear medicine study that looks at blood flow and activity. It looks at how your brain works. And the doctor that gave me that lecture, which was not that far from here, up in Fairfield in Solano County, that's where I was the director of an addiction treatment program at a psychiatric hospital. He said, this will give you more information to help your patients. And it's that one lecture that revolutionized my life. Because imaging and psychiatry, it just changed everything for me. That's why the title of the talk, Imaging Changes Everything. So here are two SPECT scans, healthy on the left. So SPECT looks at blood flow and activity, looks at how your brain works. MRI and CT, they look at structure, SPECT, PET, functional MRI, quantitative EEG, they look at function. And quite frankly, most mental health issues are functional, they're not structural. Here's someone who had a stroke. Now, she actually came to the hospital because she was depressed, and her neurological exam was normal, but you can see a quarter of her brain is missing, it's dying. This is what Alzheimer's disease looks like. You can see where the back half of the brain is deteriorating. And the scary thing about Alzheimer's is it starts in your brain decades before you have any symptoms. So those of you that are young, that are sort of waiting till you're older to get healthy, you might want to rethink that, because you don't want your brain deteriorating at any age. An example of a traumatic brain injury, this becomes a really big lesson in my life, that mild traumatic brain injury is a major cause of psychiatric disorders, and nobody knows because they're not looking at people's brains. It's a huge lesson. Undiagnosed, missed brain injuries are a major cause of homelessness, drug and alcohol abuse, depression, panic disorder, suicide, and murder. So we have to be more thoughtful. We'll talk about this a little bit. And then drug abuse. So I remember when I first started ordering scans, because I was the director of a drug abuse treatment center, and the scans were so awful, I brought them home to my 4 children and effectively induced anxiety disorders in all of them. And the real reason not to use drugs is they damage your brain. This is the message of the talk. You are not stuck with the brain you have. You can make it better. So my brain, 20 years later, is healthier than it was at 37. Yours can be too, but this is the brain warrior concept, because as you'll hear me say, you're in a war for the health of your brain. Henry was his doctor. How did he diagnose Lincoln with depression? He talked to him. He looked at him. He looked for symptom clusters. Then he diagnosed and treated him. Isn't that exactly what happens today? If you've seen a therapist and they've given you your bipolar, your ADHD, your borderline, your depressed, your whatever, that's exactly what they did, like they did in 1840, which is sort of dumb. And I've already said this, why are we the only medical specialists that never look at the organ we treat? So here's the current model, and I'm not kidding. So it's based on a document called the DSM, the Diagnostic and Statistical Manual. We have version 5, which literally is actually version 7. You tell the doctor you're depressed. He or she will give you a diagnosis called depression, and they'll give you a generic antidepressant medication with no biological information. Or you'll tell them you're anxious. They'll go, oh, well, you're anxious. And they'll give you something that actually is pretty addictive and toxic to your brain, benzos. I don't like them. Oh, I can't pay attention, which is like the whole society at the moment. And Google is partly responsible for that, but we won't blame it. So they'll give you an attention disorder diagnosis and a stimulant. Or my favorite diagnosis that explains this is you explode intermittently. There's actually a diagnostic code called intermittent explosive disorder. What the hell does that mean? It means you explode intermittently. It doesn't tell you one thing about why. And the acronym IED, really? Improvised explosive device? And Tom Insel, who used to be the director of the National Institute of Mental Health, now he works for Google, he said the unfortunate reality is that current medications help too few people to get better and very few people to get well. The DSM is 100% reliable. That means if you make the diagnosis based on this criteria today, you'll make the same diagnosis tomorrow, but 0% valid. I'm like, really? You could be the director of the National Institute of Mental Health and say that? The emperor has no clothes. It's just true. And my fatal flaw in life is I like being liked. So when you say this thing, people don't like you, right? Because you're being disruptive. And I didn't mean to be, but we have to stop lying, right? My favorite New Testament verse is John 8:32. Know the truth, and the truth will set you free. And not looking is wrong, and it hurts people. A big early lesson from our imaging work is all psychiatric disorders have multiple types. that ADD is not one thing in the brain, it's at least 7 different things. Depression's not one thing in the brain, it's probably 10 different things. Autism isn't one thing. Even people have eating disorders. You have to know their brain, not, oh, here's what we think this class of brains would look like. So here are 2 of my patients with depression. One, this shows really low activity overall. This shows really high activity. Same treatment? Of course not. This was another big lesson. It just completely changes the discussion around mental health. So in 1980, when I told my dad I wanted to be a psychiatrist, he asked me why I didn't want to be a real doctor. That is not supportive. But it's true. I can't tell you the number of teenagers I've seen who they said, I'm not talking to him. I'm not crazy. Why are you bringing me there? They hate it. They feel demeaned. They feel diminished because no one wants to be labeled as abnormal or crazy or defective. But everybody wants a better brain. So I mean, this is really, hopefully somebody from the marketing department's here. This is a marketing issue that psychiatry has. What if mental health was really brain health, right? So all of you would sign up for brain health because you're smart, right? It's like my brain runs everything, how I think, how I feel, how I act, how I get along with other people. When my brain works right, I work right. But when my brain is troubled, for whatever reason, you have mold in your house, you're going to have trouble in your life. And big lesson, you're not stuck with the brain you have. You can make it better, even if you've been bad to it. And I can prove it. So one of the most fun things we do are our follow-up scans. So we'll evaluate people. You have marital problems or temper problems, or you're depressed or suicidal or aggressive, and we'll see what your brain looks like, and then our job is to make it better. And so when I say I can prove it, let me tell you about our work with the NFL. So 1994, the NFL formed its concussion committee. Its position is if you don't admit you have a problem, you can't do anything to solve it. I've known that as a psychiatrist for a long time. If you have a problem with drugs or alcohol or your temper, and you don't admit you have that problem, you're not going to fix it, right? The first thing you have to do is admit you have a problem. So brain damaged players were left without help or hope, and in 2009, I partnered with the Retired NFL Players Association. We did the first and largest imaging study on players, and imaging changed everything. So here's our first 100 players. We saw damage across their whole brains, and it was worse than I thought it would be. And we've done some pretty cool players like Terry Bradshaw and Freddie Dreyer. This is one of my favorite players, Duval Love. He'd been arrested. He was just a mess, had filed for bankruptcy. And when he came to see us, his brain was awful. So the holes indicate areas of severe low blood flow. But when we did this study, after scan number 5, we went, I wonder if we can fix this. And so that's what we had been doing for decades, is changing people's brains and changing their lives. And so we put them on a rehabilitation program. Interestingly, the NFL changed its position in 2011. They actually put concussion posters in every major locker room and basically said concussions can cause dementia, and that you can have brain damage without ever being knocked out. It's one of the things that we learned early on. So how do you rescue your brain? This is the same thing to keep it healthy or to recover it, right? You have to get the right habits. So brain envy, you got to care about it. So when I looked at my brain, I was mad. I wanted mine to be like my mom's, so I got brain envy, right? Freud was wrong. Penis envy is not the cause of anybody's neurotic behavior. It's brain envy. You don't care enough about your brain. Then you have to avoid anything that hurts your brain. We'll talk about that. Engage in regular brain healthy habits and targeted supplements. So that was our program with the players. So you might want to take a picture of this because I don't have time to talk about all of them. But the worst thing you do for your brain is you engage in bad decisions. And decision making is ultimately a brain process. Brain injury should be obvious. Your brain is soft, your skull is hard. Should you let your children play tackle football? Only if you don't like them. One season. The research is now one season causes negative brain changes in children who play football, even if they never had a concussion. Because it's the repetitive subconcussive blows that cause the damage. I see you have soccer fields here. Should you hit a soccer ball with your head? Only if you don't like yourself. Now, if you don't like yourself, that's a whole nother discussion we should have. But your brain is soft, about the consistency of soft butter. Your skull is hard, has sharp bony ridges. Your brain runs everything in your life. Why would you ever put it at risk unless you didn't like yourself? Drugs, marijuana, alcohol is not a health food. I know. It just doesn't make me popular. And our first clinic was in Fairfield, 11 miles from downtown Napa. It's like, you know, if you have 2 glasses a week, it's like not a big deal. You have 2 glasses a day, you have a smaller brain, according to a study from Johns Hopkins. And females are more sensitive to damage than males. One of my players, his brain, and we were so excited as we did the follow-up study. Player after player, better brain, better brain. We're like little kids. And then Reggie comes in, and his brain looks worse. And I'm like, I'm bummed, because I get attached, right? I don't have the non-attachment thing. It's just not me. I'm totally attached to the outcome. And I'm like, Reggie, what are you doing? He's like, well, I stopped smoking pot for the first scan. And then I picked it up again. He said, isn't it going green? I'm like, no, I was so mad at him. He's messing up my study. Obesity. Oh my goodness. Did you know as your weight goes up, the actual physical size and function of the brain goes down? In fact, Cyrus Raji, when he was a medical student at the University of Pittsburgh, my friend Cyrus, that's actually how we met. He published that paper, and I was horrified because I then lost 30 pounds because I'm like not going to have a smaller brain. And he and I subsequently have published on this, and we looked at our own data. It's not good for you. And you go, well, why? Fat cells are not innocuous. They produce something called inflammatory cytokines, and inflammation, think of it, comes from the Latin word for fire. It's like it sets a low-level fire in your body and destroys your organs. Fat also stores toxins. Inactivity, low omega-3s, so eat your salmon or take fish oil. Not sleeping, so we have to be careful in an environment like this where productivity is so valued. We want to value sleep. Nicotine, much caffeine, a little bit of caffeine is not a problem, but much is. Diabetes, low vitamin D, all of these things. And I think the biggest one for me, besides an unhealthy peer group, because you become like the people you spend time with, is not knowing about your brain's vulnerability. So if you never look, you never know. And the brain really is sort of like the only organ we don't screen. When I turned 50, my doctor wanted me to have a colonoscopy. I asked him why I didn't want to look at my brain. Wasn't the other end just as important? So we advocate, if you have things like dementia, Alzheimer's in your family, you should probably be screened by about 40 to make sure your brain's not headed in the wrong direction. You can have a deprivation mindset if you want, but having a better brain gives you a better life in virtually every area I can think of. So, what are regular brain healthy habits? So you might want to take a picture of this too, just for the sake of time. But this is sort of a weird one for a psychiatrist. Appropriate anxiety. I thought when I was be a psychiatrist, I'm going to lower people's anxiety. I know how to hypnotize you. I love that. Do biofeedback, meditation, have the drugs that'll calm you down. And I'm like, about 10 years into it, I'm like, no, you don't need less, you need more anxiety. Low levels of anxiety kill people. So at Stanford in 1921, they started the longest longevity study ever done. It's called the Longevity Project. Lewis Terman evaluated 1,548 10-year-old kids in 1921, and then he and subsequent other researchers followed them to 2011, 90 years, looking at what goes with health, success, and longevity. And it surprised them, because it wasn't happiness or a lack of worry. In fact, the don't worry, be happy people died the earliest from accidents and preventable illnesses. The number one predictor of longevity was conscientiousness. If you said you were going to show up, and you show up consistently, reliably, repeatedly, sort of like my mom, you live longer than everybody else. And conscientiousness is a frontal lobe function, which is why you don't hit soccer balls with your frontal lobes. Good decisions, new learning, exercise. Although I heard you have thousands of table tennis tables around here. Ping pong is the world's best brain sport. Brand new study out just 2 weeks ago that people who play racket sports live longer than any other group that exercises. Nutrition, so here's the short course. Low glycemic, do not eat foods that raise your blood sugar. Sugar, bread, pasta, potatoes, rice. See if you can get rid of those or limit them as much as you can. Eat colorful things, high in fiber and high in fat. Now, not trans fats, bad fats, but good fats. Healthy weight, passion, healthy friends. So, you should write this down. The fastest way to get healthy. Find the healthiest person you can stand. And then spend as much time around him or her as possible. Sleep is really important. ANT, that stands for automatic negative thoughts, the thoughts that come into your mind automatically. You need a discipline around your thoughts. Don't believe every stupid thing you think. Thoughts lie. They lie a lot. Meditation, hypnosis, supplements we'll talk about. And then knowing about your brain. And these are the supplements we put our NFL players on. A high-potency multiple vitamin, 5.6 grams of omega-3 fatty acids. We use ginkgo because the prettiest brains I've ever seen take ginkgo. It boosts blood flow to the brain. Huperzine A, which boosts a neurotransmitter called acetylcholine, and acetylcysteine, a super antioxidant. Acetyl L-carnitine, which is for mitochondrial energy and also helps with fatigue. Phosphatidylserine helps with cell membrane function, and alpha-lipoic acid. It's an antioxidant that also helps with blood sugar regulation. And 80% of our brain-damaged players showed improvement on that plan, especially in things like memory, attention, mood, and sleep. And we did before and after scans because, this is self-report. This is not. Their frontal lobe function, which is here, and their cerebellar function was better. And the cerebellum, we could go on and on. It's just such an important part of your brain. That's why people who do coordination exercises like tennis and table tennis live longer, because you make better decisions if you're activating the coordination centers in your brain. But what do your frontal lobes do? Judgment, forethought, impulse control, organization, planning, empathy, learning from the mistakes you make. It's what makes you human. So your prefrontal cortex, so the front part of your frontal lobes, 30% of the human brain, 11% of the chimpanzee brain, 7% of your dog's brain, 3% of the cat's brain, and 1% of the mouse's brain. It's the part of you that makes you human. You never want to do anything that damages it. So here's Duval. Before, awful. A year later, incredible. And I just saw him a couple of months ago. He now just got his master's degree. He's lost 110 pounds. He's so excited. These are brain damaged people. Imagine if you've not hit your head thousands of times, but you engage in loving your brain and the right habits, it can make a dramatic difference in your life. And it's not just for football players. It's one of my addicts, my patients who has ADD, even dementia. So this is what you asked me what's new for next year, besides some of our courses, memory rescue. We're going to take people who are already going down the rabbit hole of hell for their brain and memory function and see if we can get them back. And there's evidence, actually published research, that we can do that. All right, but let's be honest. You're in a war for the health of your brain. Everywhere you go, someone is trying to shove bad food down your throat that will kill you early. I am so excited. I got a tour of the campus today, and yes, there's crap here. I walked in, and there's Twizzlers and right up front. I'm like, but then you have great options. I mean, what an incredible place to work where they care about you that much. The real weapons of mass destruction, ISIS has nothing on this. Highly processed, pesticide sprayed, high glycemic, low fiber, food-like substances in plasticized containers. That's what's killing us. News channels repeatedly pour toxic images into our minds, making us see fear and disaster around which raises cortisol, which then puts fat on your belly. And people are constantly glued to their gadgets, distracting us from our loved ones. According to a new study from Microsoft, the human attention span is now 8 seconds. A goldfish is 9 seconds. This is evolution going the wrong way. Our bad habits have consequences, though. Alzheimer's is expected to triple. No cure. It affects 50% of people 85 and older. So if you are fortunate to live as long as my mom, you have a 1 in 2 chance of being demented. And it starts in the brain decades before you have any symptoms. So this is a 59-year-old woman I diagnosed. Likely she had changes in her brain in her 20s. So it's never too early to get serious about your brain. Depression's gone up 400% since 1987. And 23% of women between the ages of 20 and 60 are on antidepressant medication. Why is that? Because most people don't know birth control pills deplete serotonin, the neurotransmitter that helps you feel happy. Now, it doesn't mean you don't take birth control pills, but it does mean if you do, you should be exercising and look at other natural ways to raise serotonin. This is awful. New study out of that was published in JAMA, 50% of Americans are now diabetic or pre-diabetic. And diabetes is a disaster for brain function. And as I said, obesity is this national crisis. And it is a national security crisis. I was at the Pentagon a couple of weeks ago talking about planting brain health in the Navy and in the VA. And they told me our health problems in the US are a national security crisis. 70% of people who try to sign up for the military are rejected because they're not healthy, with obesity being the biggest cause. You don't want to be a dinosaur, right? Big body, little brain. You're going to become extinct if we don't get serious about this problem. And what Tan and I write about in The Brain Warrior's Way is the answer is not to see these as separate disorders, but rather as different expressions of the same unhealthy lifestyle that have exactly the same cure. And that's what we call the Brain Warrior's Way. So if you want to survive and thrive, you have to be armed, prepared, and aware. Armed, prepared, and aware. And there is no suffering. Brain warriors never suffer. They eat great food. They just don't eat low quality, crappy food. They're thinking about what they put in their body because your brain uses 20 to 30% of the calories you consume. So our 2 new books, I'm so grateful that they have the book here for you. We want to help treat people, heal families, heal brains But now we're going after organizations. And I just have this sneaky idea that Google, it's already the most innovative and influential, but what if we made brain warriors out of Google? Because then you could help me change the world. Thank you so much.